Welcome to Integrity Linguistics Institute. Today we are going to discuss the Part A listening, specifically the extract 2 from the listening termed Sara Croft. So let's see what are the instructions. You hear an anesthetist talking to a patient called Mary Wilcox prior to an operation. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. So we are here a conversation between a patient and her anesthetist just prior to an operation. The patient is about to undergo a surgery. There are 12 fill in the blank questions and you have to complete those incomplete sentences with a word or a short phrase that you will be hearing from the audio. And they'll give you 30 seconds time to read all these 12 fill in the blank questions. Now, let's do the keyword analysis of the 13th question. So, reason for medication. Under this column, what do we get? High blood pressure. Okay, so the patient is taking medication to manage her high blood pressure. And what is the medication? So, the first medication is thiazide. The patient is taking thiazide for high blood pressure. All right. And along with thiazide, she is taking one more medication. Okay. And for what is she taking this mystery medication? To manage her high blood pressure. All right. So that is what we understand. So the answer is going to be a medicine to control her high blood pressure, which is taken along with thiazide. So let's see what the audio is telling us.
So, Mrs. Wilcox, you tell me you've had high blood pressure. So, are you taking any medications for that?
Yes, a blue one and a white one.
Mm-hmm. And do you know the names of the tablets?
Yes, so one's thiazide.
Okay.
And the other one's lisinopril.
All right. So the first medication is thiazide for high blood pressure and it is followed by lisinopril. So what is the answer going to be? You have to write it lisinopril. So this is the generic name of the medication. So without any spelling mistakes, you have to write down that into your answer paper. All right. So that is the first question. Now let's come to the 14th question. Okay. So here under the column known as comments, here the patient is commenting on this. Both taken this morning with dash. So both, that is thiazide and the other medication which we found it to be lisinopril, both these medications are taken for high blood pressure and both of them were taken this morning by the patient with, so along with something. So with what did the patient take these two medications? That is what we have to find out. So let's see the answer.
Perfect. Thank you. That's very helpful. And have you had them this morning?
Yes, that's what the nurse told me at the pre-assessment, yes. So is that all right? Just with some water? I usually have them before breakfast, but she said no food at all this morning.
Thanks.
All right. She takes these medications with water. Okay, so she usually takes these medications with breakfast, but today morning. So this morning, it is mentioned in the question, this morning, she was supposed to have no food. So she did not take the medication with her breakfast. All right, like how she usually takes. So today, this morning, she took both of her medications with water, just with water. So what is the answer going to be? The answer is going to be water. So you can write either some water or you can write water. Both are actually accepted. All right, so answer is water to the second question. Now let's come to the 15th question. All right. So in the previous question, as I told you, both taken this morning with water. We should not write breakfast because this morning the patient did not have any food. So just water. All right. So now 15th question. So the 15th question is going to be name of a medicine. Okay. Because it is under the section called medication. So this medication she is taking for the management of heart attack. So, okay. So since maybe as a prophylaxis or as a continuation treatment for the condition of heart attack, she takes this particular medication. All right. So let's see what is the medicine's name.
Excellent. And apart from the high blood pressure, do you have any other medical problems at all?
Yes, I take some blood thinning drugs because I had a small heart attack a bit ago. So I'm taking aspirin. And the pre-assessment, they said to keep on with them. So I had one this morning, like I usually do. They told me to stop the other one. I can't remember the name.
All right. So here, let's see what the patient is saying. So here the patient is saying, yes, I take some blood thinning drugs because I had a small heart attack a bit ago. So patient suffered a small heart attack a little while back. So for that, she's taking certain blood thinning drugs. Okay, so we can write blood thinning drugs, but here specifically they're taking, the patient is mentioning aspirin. So aspirin is the medication that she is taking because she had a heart attack a little while back. So aspirin is the right answer to the 15th question. Now let's go to the 16th question. So 16th question is also the name of a medication, and she is taking this medication for the management of her heart attack. Alright, so let's see what that medication name is.
Warfarin?
No, it begins with C. Clopidogrel. They told me to stop it a week before the operation, 7 days.
Fantastic.
So I stopped last Tuesday.
Great.
Alright, so here the answer is going to be clopidogrel. Alright, so here as you can see, it is continued by the statement, they told me to stop it a week before the operation, that is 7 days. Alright, so see, clopidogrel, stopped taking this 7 days ago. Okay, so I should have mentioned this previously. So 7 days ago, she discontinued this medication. So what she discontinued? Clopidogrel. Right, so that is the answer. So clopidogrel is the answer to the 17th question. Okay, so that was the 16th question's answer. Now let's go to the 17th question. Medical history. Went to the general practitioner 2 years ago feeling dash. So 2 years ago, the patient consulted with a general practitioner because she was feeling some kind of a symptom. Okay, so she was feeling something, an unpleasant symptom. So that's why she went to a GP 2 years ago. So this is regarding her medical history. So let's see what the answer is.
Now, tell me a bit more about this heart attack. How long ago was that?
2 years ago, my GP picked up on it.
Did that all go?
Yes, pretty good.
And why did you go to your GP? Were you having chest pains?
They weren't chest pains. They were, I was just getting a bit breathless, and it was difficult for me to tell what was going on, but Dr. Scott picked up on it when I went to see him, and he sent me to the cardiology team.
All right, so here the patient is actually saying she went to the GP 2 years ago. All right. And the doctor is asking, did you go to the GP because you were experiencing chest pains? So this was the question. But the patient is saying, no, they were not chest pains. So the patient did not go to the GP 2 years ago because she was suffering chest pains. She went to the GP because she was experiencing breathlessness. Okay, so that is the reason why she visited the general practitioner a couple of years ago. So what is the answer going to be? Breathless. Alright, so the patient was feeling a little bit breathless, that is, she was experiencing shortness of breath. So you can write either a bit breathless or breathless, both are actually accepted. So that is the answer to the 17th question. Now let's come to the 18th question. Let's do the keyword analysis. Had to dash inserted. So the patient was inserted with two things. Okay, so into the body, two things were inserted. So what was added to the patient's body? That is what we have to find out. So let's see what the audio is telling us.
Did they say you'd had a heart attack?
Yes, they told me I'd had a small one, and so I had some stents put in, a couple of them.
And since they were done?
Yes, I've been better. You know, I don't feel so tired all the time.
Okay. And what can you do in terms of exercising?
Alright, so here, what was the question? Had to dash inserted. So two means what? Couple. So here the patient is saying, they told me I had a small one, and so that is heart attack. She had a small heart attack, and so I had some stents put in. Okay, so she was inserted with some stents. And how much of them? A couple of them. So couple means what? Two. So into the patient's body, 2 stents were inserted. So the answer is stents. Okay, so this is the answer. Why was a stent inserted? It was inserted because she suffered a small heart attack. And couple means two, so the answer becomes stents. So you must write stents without any spelling mistakes into your answer paper. So right, so that is the answer to the 18th question. So now we have understood the answer to the 18th question. Let's go to the 19th question now. Present condition. So presently, what is the patient's condition? The patient is all right with dash and walking on the flat. Okay, so patient is okay. That means she is really capable of doing this activity. So there is going to be an activity all right with one particular activity, and along with that she is all right with walking on the flat as well. All right, so let's see to what is the patient okay with.
Well, I can do anything. Anything, really.
Tell me what you can do.
Well, we have stairs at home, and we don't have a loo on the ground floor. It's on the first floor. So I'm up and down a few times a day.
All right, so this is a slightly complex and a little bit of a cunning question. So here the question was this: all right with dash and walking on the flat. All right, so here the patient is saying, well, we have stairs at home, that is steps, and we don't have a loo. Loo means bathroom, toilet on the ground floor. All right, so on the ground floor of the patient's house there is no bathroom, so she has to go to the first floor to go to the bathroom. All right, it's on the first floor, so I'm up and down a few times a day. All right, so whenever she wants to go to the bathroom, she can very easily climb the stairs up. Okay, she can go up the stairs and she can come back down. She does not have any problem. She's really all right with it. So what is the answer going to be? The answer is going to be walking up and down the stairs. Okay, so you can write up and down the stairs, going up and down the stairs, or going up the stairs. Okay, so all of these words are actually accepted according to the OET answer key. Okay, so that is the answer to the 19th question. Now let's go to the 20th question. So let's do the keyword analysis of the 20th question. Has swelling in one ankle following operation for dash. So the patient is having swelling in one of her ankles. All right, and ever since when did she start experiencing this swelling? So she got the swelling on one ankle following, that is after an operation. So she underwent an operation, and after that operation she has been experiencing swelling in one ankle. So for what? So for what condition did she undergo the operation? That is what we have to find out. So again, so for what particular disease or condition she underwent the surgery? That is what we have to find out, because operation for, and she got this ever since this operation she has this swelling in one ankle. So let's hear the audio anyway.
Any problems with your ankles swelling?
Well, this one, it swells up if I've been standing. I had my veins done, my varicose veins, but the other one's all right. I sprained it quite badly last year, but it's fine now.
Right. Can I just ask you a few other questions about your heart?
Sure.
All right, so here the patient is telling, again, this is a very casual colloquial way of speaking, so it is a little bit complex for non-native English speakers. So here the doctor was asking, any problems with your ankles swelling? So here the patient is saying, well, this one, it swells up if I have been standing. All right, I had my veins done. That means she underwent a surgery for her veins, that is her varicose veins. So she has been suffering from varicose veins, and because of that she underwent a surgery. Okay, so that is the operation. So she underwent an operation for varicose veins, and after that, whenever she stands up, her ankles becomes swollen. So what is the answer going to be? The answer is going to be varicose veins. So without any spelling mistakes, make sure you're writing that down into your answer paper. Alright, that is the answer to the 20th question. So now let's come to the 21st question. Denies dash. So denies means what? Refusing to acknowledge. The patient is saying no. Okay, refusing to acknowledge something. So what is the patient refusing to? That is what we have to find out.
Ever had any palpitations at all when your heart goes bum bum bum?
No.
You've never experienced any of those?
Well, no, not really. I mean, if I run, my heart beats a bit faster, but that's normal, isn't it?
All right, so here What is the patient denying to? So here the doctor is asking her, have you ever had any palpitations at all? All right, so any palpitations. So here the patient is saying no. The patient is saying no here. All right, so she's never really experienced a palpitation. So denying palpitations. Okay, that is rapid beating of the heart. Okay, so denies palpitations or denies having palpitations, because when the doctor asks whether she is having palpitations, the patient is denying by saying no. So that is the answer to the 21st question. The answer is palpitations. Now let's come to the 22nd question. Reports some dash at night, responds to medication. So the patient is saying that she experiences something during the night time. So during the night time she experiences something, and when she takes medication it goes away. That means with medication it is easily treated, but it happens only during the night time. All right, so let's see what happens to the patient during the night time.
Okay, sure. Anything else? Any digestive problems?
No. Well, if I have a heavy meal late at night, like if I have a pastry or something, I sometimes wake up in the night feeling a bit like the heartburn. But if I take an antacid, it's fine.
Right.
Okay, so here the patient is saying what? The patient is saying, if I have a heavy meal late at night, like if I have pastry or something, pastry means something sweet like cakes, I sometimes wake up in the night feeling a bit like heartburn. All right, so the patient experiences heartburn, especially during the night time, if she takes heavy meals. All right, and she takes antacid, it's fine. Okay, so whenever she takes any antacids or antacids, then it goes away. So what does she experience during the night time? Heartburn. All right, so heartburn or acid reflux, this is what she experiences during the night time, especially after a heavy meal like pastries. So heartburn is the answer to the 22nd question. So we have understood that. Now let's come to the 23rd question. Concerns expressed dash following the procedure. So the patient is expressing one particular concern, that is she is a little bit worried about something. All right, and following the procedure. Following means after the procedure. So she underwent a procedure and after that she is having one particular concern. So let's see what that concern is. So let's see what the audio is telling us.
So in general, you sound to be in pretty good shape.
Mm-hmm.
Now, in a minute, I'll tell you about exactly what type of anesthesia we'll be using. But first of all, is there anything you'd like to ask me? Do you have any concerns about anything?
Well, I suppose the main thing is after the operation, when I wake up. Will I be in a lot of pain when I come round?
No.
All right, so here the question is this: concern dash following the procedure. So the patient is concerned that she might experience something after the operation or the procedure is completed. All right, so here in the audio the doctor is asking her, do you have any concerns about anything? So the patient is answering, well, I suppose the main thing, that is the main concern after the operation, that's when she wakes up. So after the anesthesia is done, after the operation is done, when she wakes up, that's when she comes around to her senses, she is concerned that whether she is going to be in a lot of pain. Okay, so she is very scared that after her operation, when she opens her eyes, when she becomes awake, she is going to have a lot of pain. So that is her main concern. All right, so when the doctor asks, do you have any concerns? She says, yes, the main thing is I'm concerned that I'll have a lot of pain after the operation. So what is the answer going to be? Pain. So she is really concerned about experiencing pain following the procedure. So that is what you have to write, pain, as the right answer. That is the answer to the 23rd question. Now let's come to the 24th question. Possible damage to crowns, both are dash. All right, so here the patient is saying that, what the question is this: possible damage to the crowns, that is the upper part of the teeth, and some teeth are actually called crowns. Both are dash. Okay, something related to the teeth. All right, so anyway, let's see what the audio is telling us. So here what I have done is I have only chosen the question that we are supposed to look into. Okay, I have written only the question. So that is the reason why it is not mentioned that it is teeth, but in the question paper you can actually see there will be a little bit more details over there, so that you can easily figure out that we are talking about teeth over here. Okay, so possible damage to crown. Possible means what? There is a small chance. There's a small chance that there is going to be damage to the crown, that is teeth of the patient, and both are what? So both are something. That is, two things are exactly the same thing, but what are those two things? That is what we have to find out, and that is closely related to damage. That is a damage that may happen to the crowns of the teeth. Alright, so let's see what the audio is.
You'll be given morphine during the procedure, and that will still be working when you wake up. And then when that wears off, you'll be given something else. There'll be someone keeping an eye on you.
Okay. Oh, the other thing is, I've heard that if you have crowns in your mouth, they can get damaged if they put in an air tube.
Well, it's unlikely, but we'll take special care. So, which teeth are we talking about?
These two.
Okay, the two central incisors. And do you have any other teeth with crowns or implants?
No.
Alright, so here the patients, so we usually wear caps or crowns. Okay, so whenever they some patients go to the dentist, the dentist actually gives them a cap or a crown to protect the teeth. That is what is actually mentioned over here. So this is again an extension of the concerns the patient is having for the procedure. Alright, so here the patient is concerned that since the patient has crowns in her teeth, whether she is going to sustain an injury or damage to the crowns when the air tube is inserted. So so whenever the patient is going to get a surgery, general anesthesia is going to be used and air tube is going to be placed, alright, to help the patient breathe. So while this procedure is being done, the patient is really concerned whether the air tube is actually going to damage the crowns that she has installed into her teeth. Alright, so the doctor is actually unaware of it. So he says it is unlikely, that is, the chances are very less. But the doctor promises the patient, yeah, we will take special care. But he needs to know which teeth has the crowns. Okay, so which teeth has the caps. So when the doctor asks this question to the patient says, yeah, these two. Alright, so the doctor says, yeah, the two central incisors. Okay, so these two, that is I think it is these two teeth. Alright, so these are the two central incisors. So the patient is wearing crowns to the two central incisors, and the patient is concerned that whether the air tube is going to cause damage to the crowns. Okay, so it's not a very easy answer, it's a quite slightly complex over here, but it's anyway, this is the quality that OET demands from us. So the answer is central incisors or incisors, however you want to pronounce it. But the important thing is to say it, to write it down without any, without any spelling mistakes. I think incisors are these two teeth, the sharp teeth that everyone has. That's the central incisors teeth. But anyway, since we are all medical professionals, it should be quite easy for us to write down the answer. So this is why OET is slightly different from the IELTS. For it is little bit easier for medical professionals. Alright, so now we have concluded the answer to the 24th question as well. So now it is time for your homework. So please go and take your printed question paper, practice the part A as you listen to the audio, and check the answers with the answer key. And if there are any mistakes you have made, then come back to the class and review the class. Alright, so make sure you're thoroughly grasping each and every question. Create your own notes. This is extremely important. Make your own self-study notes from the class as well as from your practice experience. So that marks the end of today's session. So on behalf of our entire team, I would like to express my heartfelt gratitude to you. Please remember, you're not just students, you're cherished, valued, and deeply loved. As you move forward, carry our love with you. Wishing you all the very best. If you have any feedback, any thoughts or inquiries, please let us know at integratedlinguistics@gmail.com. We love hearing from you. Thank you very much. Have a fantastic day.